All right, let's talk about a real medical paradox, a situation where a super common, everyday treatment gets pushed to its absolute limit to pull off what really looks like a miracle. Today, we're diving into how a drug we all know, insulin, is used not for diabetes, but as a last-ditch effort to save a poisoned heart. I mean, that sounds completely backwards, right? Insulin, its whole job is managing blood sugar. The heart's job is to pump blood. So how on earth did doctors figure out that flooding the body with one could rescue the other from total collapse? That's the big question we're going to unpack right now. So, our story begins right at the edge of life and death. Picture this. We're in a critical care unit. A patient is in what doctors call refractory shock. Basically, their entire cardiovascular system is just collapsing. Their blood pressure is crashing, and all the usual treatments, the go-to rescue drugs, they're just not working. And the cause? A really severe drug overdose. Okay, so what kind of overdoses are we talking about here? We're talking about overdoses from really common heart and blood pressure meds, things like calcium channel blockers and beta blockers. Now, normally, these drugs are lifesavers, but when someone takes way too much, they can basically paralyze the heart. It just can't pump effectively. And that creates this awful situation where doctors are just running out of options, and they're running out of them fast. And this is where our unlikely hero shows up. When all the standard rescue drugs have failed, doctors, specifically toxicologists and critical care specialists, they turn to something you'd expect to see in a diabetes plan, insulin. But listen, we are not talking about a normal dose here. We're talking about a massive, almost unimaginable amount of it, an amount that completely changes the rules of what this drug can do. So the official name for this is High Dose Insulin-Euglycaemic Therapy, or HIET for short. It's a mouthful, so let's break it down. High-dose insulin, pretty obvious. Euglycemic just means keeping the blood sugar normal, which is key. But the really important word here is inotrope. See, in this poisoned, shocked state, the heart cells are literally starving for energy. High-dose insulin acts like a super powerful inotrope. It strengthens the heart's muscle contractions by basically kicking open the gates to the cells and flooding them with glucose, their main fuel. It gives them the power they need to start beating properly again. And to really get your head around just how wild this is, check out this comparison. Standard insulin therapy for diabetes, that's like using a tiny eyedropper for precise, careful doses. HIET, that's bringing in a fire hose. The goal has nothing to do with fine-tuning blood sugar. Nope, this is an all-out, full-scale rescue mission for the heart. We've completely left the world of diabetes management, and we're now on the front lines of emergency toxicology. Okay, so if this isn't anything like normal insulin therapy, what does this high-stakes rescue mission actually look like in practice? Well, it's definitely not as simple as just grabbing a syringe of insulin. It's a really carefully orchestrated protocol designed to get the maximum benefit for the heart while trying to manage some absolutely enormous risks. Let's walk through the key steps. You can think of it like a 3-step dance, and it's happening on a razor's edge. Step 1. You load the patient up with sugar. I know, it sounds totally backwards, but you're about to give so much insulin that it'll just sponge all the sugar out of the blood, so you have to load the system up first. Step 2, you hit him with the insulin, a huge dose right at the start, followed by a continuous, really powerful IV drip. And then, step 3, you watch. Like a hawk, you're constantly titrating, that's just adjusting the dose every few minutes, based on exactly how the heart is responding. Now, as you can probably guess, using a drug in such an extreme way is, well, it's incredibly dangerous. This is not a simple fix, it's a total high-wire act. The very things that make this therapy so powerful for saving the heart are also the things that create some massive risks that have to be managed literally minute by minute. And this quote right here from the medical guidelines, it's not a suggestion. It is a hard, fast rule. This is a therapy of last resort. You only do this in the most advanced critical care settings, and you always have a clinical toxicologist, a poison specialist, guiding every single move. That should tell you just how serious this is. So let's get into those main risks. The most obvious one, of course, is hypoglycemia. That's where the patient's blood sugar just crashes to dangerously low levels. But there's also something called hypokalemia. You see, insulin doesn't just move sugar into cells, it also drives potassium in there too. And if your potassium levels in the blood get too low, well, that can cause a whole new set of life-threatening heart problems, a real catch-22. I mean, this table really gives you a picture of that tightrope walk we've been talking about. Just look at the monitoring frequency. Blood sugar and potassium levels are checked every 15 minutes. Can you even imagine that intensity? A constant cycle of test, adjust, all to keep the patient inside this tiny, tiny window of safety. It's just an incredible testament to the skill of the critical care teams that pull this off. But here's the thing. When this incredibly intense therapy works, the results are just amazing. The patient's heart starts to regain its strength, their blood pressure stabilizes, and that immediate terrifying crisis begins to fade. So how do doctors know? How do they know for sure that it's time to start dialing back this extreme treatment? Okay, this is honestly my favorite part of this entire thing. One of the very first signs that the heart is actually healing is that the patient's need for sugar starts to go through the roof. Their body starts demanding more and more and more glucose just to keep up with all that insulin. And what that tells the doctors is that the heart cells aren't stunned anymore. They're awake and they're actively gulping down that fuel to recover. It's this beautiful, completely backward sign that they're winning. You know, the whole story of high-dose insulin therapy is just this powerful reminder that even the medicines we think we know inside and out can have these incredible hidden depths. It really makes you wonder, doesn't it? What other everyday drugs just sitting there on a pharmacy shelf are holding on to some extraordinary life-saving secret, just waiting for the right crisis to come along?